Where would you say we stand now in terms of trying to get schools reopened safely? I mean, we've seen what's happened with colleges. There's been some quite a bit of COVID cases, but not a lot of deaths there. In grade school, in elementary schools, you've got teachers though that might be in that high risk group over 50, and teachers hesitant to go back. How do you? I keep saying thread the needle, but how do you thread the needle, especially as we're going into fall, where we might have a convergence of influenza as well as COVID? It just seems very, very daunting, what we're trying to do.
So I heard some good news that Miami-Dade, our fourth largest school district in the United States, may be reopening for physical environment for school setting for kids. Listen, we believe it's safe to get back to school, and that actually Dr. Redfield from CDC, Dr. Ellie McCants-Katz of our Substance Abuse Mental Health Services Agency have made clear that being in a physical school environment is vital for our kids, for their physical well-being, their emotional and mental health, and also nutrition services. It can be done. We just have to set our mind to it. It's really the 3 W's of public health. Wash your hands, watch your distance, wear your face coverings when you can't watch your distance, and stay out of settings where you can't do those 3 things. So what do? We've got guidance out for schools on how to set up the school environment for social distance, how to rotate the teachers instead of the kids, bring food to the kids instead of having them congregate in cafeterias, cohort the kids, cohort transportation. This can get done. We can keep our kids safe. We can keep our teachers safe. But at the end of the day, what we always say and what we've guided people to is assess your own individual circumstances, whether it's you as a parent and guardian for your child or a teacher or other staff member at a school. Assess your own vulnerabilities and be guided by that. But we believe we can be back to school, we can be back to work, back to health care if we just practice basic common sense of public health.
Go ahead, Beck.
Just Secretary Azar, on that point, my son's in school, in elementary school, and I feel like the school's doing a really great job. I do have some concerns about what's happening outside of school. Do you think sports are safe if the kids aren't wearing masks?
Well, I'm going to defer to CDC on assessing that. I don't know if they've put any guidance out about various sporting activities. I think you're right to ask that question because, again, it's always about those 3 W's, and are you able to be washing your hands, watching your distance, and wearing face coverings, and what's the level of contact where transmission could occur. So I don't want to speculate on that. I really would like to point people to any guidance CDC has on that at coronavirus.gov rather than getting out there and speculating there.